A person's smile makes a first and lasting impression, and more people want to make sure that they put their best forward with a wonderful smile. A big part of that is white teeth. And joining me from StoneRidge Dental Care, Cynthia Levy, along with patient Jim Wasserstrom. Welcome to both of you.
Thank you.
Cynthia, let's first talk to you about teeth whitening, because it used to be that, you know, only if you were really well-to-do would you do this, and now it's just become so commonplace, which is a wonderful thing.
It is. It's very commonplace. Teeth whitening is probably one of the easiest and least expensive and most convenient things you could do to change your smile.
And least expensive, too, I know. What do you tell people before they decide whether or not they should have their teeth whitened? What kind of precautions, if there are any?
There really aren't that many precautions. It's relatively safe. The problems with teeth whitening is that if you have any sort of crown and bridge work in the front of your mouth, that doesn't bleach. Sometimes people have more severe problems. They're trying to cover up, perhaps dental disease and problems with teeth whitening. And obviously, if you don't have healthy gums, teeth whitening would not be something that you should even try.
And that's just the tip of cosmetic dentistry.
It is.
What else do you offer, and what does cosmetic dentistry really mean?
Cosmetic dentistry is really anything that enhances your smile, that changes your smile. And it can be anything from teeth whitening to orthodontics, all the way to cosmetic bonding and the gold standard, which we use as porcelain veneers.
Now, Jim, what did you have? And you want a smile makeover, basically.
I certainly did. I first never liked the color of my teeth. As I was growing older, my teeth changed, and they never really looked right. Also, my bottom teeth were always crooked. I had about 3 appliances made to correct my teeth so they wouldn't actually, go into place. And unfortunately, or I should say fortunately, when I had these capped, they actually got rid of all those teeth that looked crooked. They still are underneath.
So yours were capped. Is that what you call that, Cynthia?
He's had, I think, a combination of crowns or caps and veneers.
And we have some before and afters, Jim, and there is quite a difference. And now, are these will last him for the rest of his life, Cynthia?
They should. I mean, they're, I think if you take good care of your teeth and everything, you're probably looking at 20, 30 years on something like this. They may have to be redone at some point.
What is the difference between caps and veneers?
A cap is sort of a crown is sort of covers a full tooth. There's a lot more reduction in the tooth structure. A veneer is a very, very thin porcelain facing.
Like an overlay?
Almost like a fake fingernail is the best way to think about it, that goes on the front of the tooth.
Now, Jim, how was the process for you? Was it long?
Absolutely not. I think it was, I was in for about an hour and a half, maybe 2, to prepare the teeth for these caps. Then I had temporaries put on while they were being made, and I think that lasted about 3 to 4 days. Then I went back in, put them on, and immediately I couldn't believe the difference. It was a total smile. My face that used to have crinkles in the top wrinkles of my face all went away. I just smiled better, and I felt
you had more
very
confidence.
Good. Very much.
You see this a lot, Cynthia.
We see this all the time. One of my favorite stories from our office is a young man who graduated from high school and basically didn't leave his house for a few years. He was so ashamed of his mouth.
That's sad.
Very sad. And he finally came in. We had a complete smile rejuvenation. He went on to college. He's graduated. He has a full, active, productive life, and he smiles all the time. And we have people come in and say, people treat me differently. They used to think I was grumpy. I was grumpy because I didn't smile.
Well, you said you frowned more, Jim.
Right, right. And now that all my friends have noticed how I smile more, I'm more happy to be around, especially with the mouth looking that way. And I have a lot of people that don't take me serious now that I have such a big smile.
I don't know, you're a pretty big guy. Whatever you say goes. I treat you seriously. Cynthia, thank you very much. Jim, thank you for sharing your story. We appreciate it.
Thank you.